Hi, this is Dr. Applin, and today I would like to talk about physical therapy for plantar fasciitis. But first thing is to define what plantar fasciitis is. Fascia is essentially just a fancy term for a sheath of soft tissue that holds everything in place together. So if you look at my model here, the plantar fascia would go on top of everything here, holding in the tendons and ligaments that are on the bottom part of the foot here. Now, cause of plantar fasciitis can be one of many different things. If you have tightness or injury in the Achilles tendon back here, that can cause plantar fasciitis. If you have bone spurs, which can be due to repetitive stress or arthritis around the ankle joint, those can actually poke into and irritate the plantar fascia. Another way is direct trauma. Say if you're a soccer player and somehow you come down hard on the bottom of the foot, that can cause plantar fasciitis. But what we see most frequently is just repetitive stress plantar fasciitis. People who are on their feet for long periods during the day. No different than any other joint. If you're just, or any other area of the body, I should say, if you're just constantly putting pressure on it, it's going to become more prone to irritation and inflammation. One of the reasons why this is so significant is because you put pressure on your plantar fascia each time you take a step. And as people with plantar fasciitis know, this can actually be a pretty debilitating condition. And some people seek out medication for it, some people seek out injections for it, or even surgery. But oftentimes we can significantly reduce or even eliminate the symptoms of plantar fasciitis through a course of physical therapy. And essentially what our goal through physical therapy is to stretch out the area as much as possible and then stabilize the area as much as possible. We usually start by doing some massage to the soft tissue there, especially if you have a lot of sore points in that fascia or soft tissue. The massage itself can be quite relieving for the plantar fascial pain. But we also want to stretch those muscles around it, like the gastroc muscle, which attaches to the Achilles tendon, which will reduce some of the pressure. Oftentimes we have to mobilize the ankle joint, which can reduce some of the pressure on the plantar fascia. But there's also some specific rehabilitative exercises that will help stabilize that area, not only reduce the amount of pain you're in due to the plantar fasciitis, but also help prevent it from coming back in the future. There's another service we offer with a cold laser device, which seems to be especially effective on plantar fascial pain. And what the cold laser does is it penetrates through the skin and into that plantar fascia, improving circulation, soothing the nerves, and it actually improves the healing time of the plantar fasciitis. There's some very good athletic taping techniques, and I say athletic taping, but you don't have to be an athlete in order to benefit from these taping techniques. But what the taping techniques do is they kind of take up some of the pressure or weight of the plantar fascia while we're going through our treatment. So significantly can reduce the amount of pain you're in between treatment sessions. Go ahead and read through the article. I think there's some good information in there. Thank you very much.